VA offers an urgent care benefit that provides eligible veterans with greater choice and access to timely, high-quality care. Urgent care providers treat minor injuries and illnesses, including flu-like symptoms such as coughs and colds, sprains, sore throats, and bumps and bruises. For example, if you're an eligible veteran and one day you wake up with flu-like symptoms, you can go to an urgent care provider that is part of VA's contracted network of community providers for treatment. The benefit supplements care that veterans may also have access to at a VA medical facility. To be eligible for urgent care, veterans must be enrolled in the VA healthcare system and have received care through VA from either a VA provider or community provider paid for by the VA within the past 24 months. To check their eligibility, veterans can contact their local VA medical facility by phone or in person. Eligible veterans do not need to get prior authorization from VA to visit an urgent care provider in VA's contracted network of community providers. VA can only pay for care under this benefit if the veteran is eligible, the services are covered under this benefit, and the provider is part of VA's contracted network of community providers. If a veteran goes to an out-of-network urgent care provider, they may be responsible for the full cost of care. To find an available urgent care provider in VA's contracted network of community providers, veterans can use VA's facility locator on va.gov or contact their local VA medical facility. Veterans must notify the urgent care provider that they are using their VA benefit for the visit, and the provider will verify their eligibility. Please note the following about urgent care. Urgent care is not an adequate replacement for emergency care. If a veteran has a medical emergency like chest pain or a large broken bone, or needs immediate help due to an accident or injury, they should call 911 or go to an emergency department immediately. Urgent care is not an adequate replacement for preventive health care, disease prevention, or management of chronic or long-term conditions. Veterans should work with their primary care provider for these types of care. If a veteran goes to an urgent care provider and receives services that are not covered by this benefit, they may be responsible for the full cost of care. Veterans may be charged a VA co-payment for urgent care that is different from other VA medical co-payments. VA co-payments for urgent care depend on the veteran's assigned priority group and the number of times they visit an in-network urgent care provider in a calendar year. For priority groups 1 through 5, there is no co-payment for the first 3 visits during a calendar year. For the 4th or more visit in a calendar year, the co-payment is $30. For priority group 6, there is no co-payment for the first 3 visits during a calendar year if the visit is related to special authority or exposure. For the 4th visit and all subsequent visits in a calendar year, the co-payment is $30. If the visit is not related to special authority or exposure, the co-payment is $30 per visit, regardless of which visit it is. For priority groups 7 through 8, the co-payment is $30 per visit. For priority groups 1 through 8, there is no co-payment for a flu shot-only visit. Visits consisting only of a flu shot do not count as a visit for the number of visits in a calendar year for eligible veterans. In addition, please note that co-payment charges are billed separately by VA as part of VA's billing process, and there is no limit to the number of times an eligible veteran can go to an urgent care provider. For prescription medication of a 14-day or fewer supply written by an urgent care provider, veterans can either fill the prescription at a contracted pharmacy in the VA network, at VA, or at a non-contracted pharmacy. VA will pay for or fill prescriptions for urgent care. For urgent care prescription medication longer than a 14-day supply, the prescription must be submitted to VA to be filled. If a non-contracted pharmacy is used, veterans must pay for the prescription and then file a claim for reimbursement with their local VA medical facility. To learn more about urgent care, please contact your local VA medical facility or visit va.gov.